the Vermont Farmers Food Center here on West Street in Rutland. This is our Farmacy Project, our food as medicine prescription program that started in 2015. We have our wonderful volunteers and staff who are working. Right now they are bunching basil for all of the bags. And we have about 7 to 10 farms that we partner with in Rutland County that drop off on Wednesday mornings, and then our crew bags all of the bags, 225 of them. And we send some out to the other areas of the county, and we have a pickup here at the Vermont Farmers Food Center and one at the Rutland Community Health Center on Stratton Road.
I'm Ryan Yoder, Yoder Farm, Danby, Vermont. We rent from Smoky House Center, and I'm also a member of the VFFC board. We grow beans and popcorn, also a bunch of vegetables, berries, stuff like that. I've gotten to be one of the farmers of the pharmacy program, and so that's been an income boost and a market for us. And then beyond that, we also market at the Vermont Farmers Market. So that is hosted inside at the food center. And so we've benefited that way as well.
We work with our farm partners to develop a plan every year. And we usually know what we're getting week to week. It always changes a little bit depending on the season, the amount of rain. You know, some crops fail, some crops are just growing really great. But every week we try and have a nice mix of vegetables and fruits in the bag. This week we have some wonderful chard. We have apples from Brown's Orchard from last year to get some fruit in the share. We had strawberries last week. And we always try and get an herb in there too to just like make the share really smell delightful. The basil smells wonderful. So every bag gets the same amount of vegetables, the same types of vegetables. So the bags are here until they're picked up around noon and distributed throughout the county. And then at 3 p.m. we have the distribution here at the Vermont Farmers Food Center and one at the Rutland Community Health Center. I am Emma Hileman. I help run the Farmacy Project at the Vermont Farmers Food Center. And I'm here with Tia and Lori from the Rutland County Free Clinic.
Yes.
And yeah, tell us a little bit about the Free Clinic.
So the Free Clinic serves all of Rutland County, and we serve adults only, residents of Rutland County who are uninsured or underinsured. And just in need of healthcare services. And we also have an adult immunization program that we started last year that's very popular too. I am a tobacco treatment specialist, and so we do offer an option for those who would like to address nicotine addictions. And then there's also the You First program that Lori is a You First champion.
I am a You First champion. So I try to get everyone I can possibly get signed up for the You First program. And that can be anyone who does have insurance, but their income level is low. And it's a wonderful program. That's how a lot of our people actually got into the pharmacy program this summer, was through You First. It's just a wonderful program, and we promote it. No one gets away from the Rutland Free Clinic if I can get my hands on it.
And so we've been partnering with the Rutland Free Clinic for I guess 4 years now with the Vermont Farmers Food Center. And we started because Tia was helping to run a program through the Rutland Free Clinic called Teeth and Tomatoes, which was focusing on the outlying areas of the county. I was an intern at the food center at the time, so Tia and I worked closely in 2019 that summer. And do you want to describe a little bit about those?
Yeah, sure. So we really were, we try to provide a lot of education in what we do at the free clinic. And because we truly believe that people will make healthier choices if they understand, if they have the knowledge and information and are better equipped to do that. So the Teeth and Tomatoes program was a pilot program that the prior ED, Tony Morgan, actually came up with the idea of how, coming up with a program where we can educate people to the importance of fresh produce, fruits and vegetables, and if at all possible, help to connect people who might have difficulty accessing that with it. So together we wrote a grant to United Way of Rutland County that partially funded the pilot program. And what it actually was me going out each week, starting in July. We would collect the farm share, go out to Brandon, Pittsford, Pontley, and meet with a group of participants that I had agreed to try the program, and not only bring them this wonderful produce, but also educate them. They would learn, how to prepare, what recipes they could make, the advantages of the food that they were receiving and the importance of that. And then even in addition to that, we might bring education about the Stop the Bleed program training, or Medicare plans, or something in addition to that. But I would spend about an hour each week with that group at a designated community location in that town, and it was just wonderful. Eventually we had people that they were there before I arrived. They were taking their own blood pressure. We would bring a blood pressure unit out, and so they were tracking their blood pressure readings. They would share recipes. They started sharing recipes among themselves and tips about how they would prepare some of the vegetables and some of the meals they would make from them. And so it really was a great success. And the funds that we received from United Way allowed us to kind of do this. We were able to purchase a certain amount of shares. And so then the following year, it was kind of, well, just life. We knew we weren't going to have the capacity to replicate the program, to repeat that same program again. And then we were wondering, gosh, how are we going to find the funds to be able to get some more pharmacy shares now that we've experienced for the first time what this program is, how great it is, and we want to keep it available for our patients. And the pharmacy program was just wonderful. It's like, look, if you've got patients, we're going to find a way to get them a share. And so we continued to come along, and then You First came to the table, which usually has benefits, looks for different benefits for their members. And so I said, hey, what about a pharmacy share? So connected You First with Emma, and lo and behold, now You First is willing to purchase X amount of shares and designate them for the clinic. So then that shifted to Lori's wheelhouse. And how many shares did you do for this year for You First?
We are sending, between You First and our clinic, we are sending 48 people.
Are receiving farm shares
So
this
that's
year.
wonderful, wonderful.
Yeah. Yeah, and part of that was also made possible through the Vermont Food Bank, the Vermonters Feeding Vermonters program this year. So we're very grateful to have both You First and the food bank supporting our partnership.
Absolutely.
And really expanding that number, because I think we only did about 20 or something last year, so we've doubled that from years previous. And what was really great about the Teeth and Tomatoes program in the outlying areas of the county is that those relationships that were formed through Tia and Tony, we kept those up at the Vermont Farmers Food Center. So then I was able to start sending shares out to those locations. We connected with Patty LeDuc out in Brandon, who's just a wonderful community volunteer. And we just kept up all of those partnerships, and we've been sending upwards of 75 to 90 shares out into those outlying areas this year for pharmacy.
Because of course, that's one of the things that a lot of our resources that are available in Rutland require people, right, to come to Rutland for them. So they have transportation obstacles, you know, is always a primary concern for folks. So, you know, where those Brandon residents could participate in the pharmacy program before, they would have had to drive all the way into Rutland every week to pick up their farm share. Where now, yeah, they can go to, is it still at the Neshabie School?
It was, and now it's at the Brandon Community Health Center. So we
that's-
strengthened our relationship with the community health centers, and most of our pickups are at the clinics out there. But I actually just heard from somebody at Neshabie yesterday who is seeing if we have any availability to add some folks into the program. So we still have that communication going between Neshabie.
Yep.
So, yep.
And feedback that I'm getting already, just since it started in July, is everyone's loving the vegetables. They're into the vegetables. They love the recipes that are being put in the bags to help them figure out what to do with them. And they look forward to it every single week. Every single week.
Yeah.
Unfortunately, it's a lot cheaper to eat bad than it is to eat good. And so this opportunity for our members and our patients, I mean, it's just wonderful for them. They probably wouldn't spend the money at the grocery store or have the money at the grocery store. But through the pharmacy program, I mean, my people are just loving it. They just love it.
And when we think of wellness, you know, where we try to think of, you know, you think, well, the free clinic is treating acute illness, but we like to think we're helping people become more well, increase their wellness. And wellness isn't just physical. It's emotional, it's spiritual, it's financial, it's socialism. And that's another part that I just love about the pharmacy program, is that those individuals are going to connect with other people at some point. They're going to receive material every week that's going to provide them with information they didn't know, increase their awareness so they make healthier choices, but they're also going to have increased engagement that's naturally, organically going to occur. And, you know, that's just frosting on the cake. Not that we're going to eat the cake unless it's carrot. But you know what I mean. I mean, it's just an added bonus. All these other elements that, you know, when you report the final outcome on a grant, you have those outcomes, you know, when you write that grant, that you have in mind, that's your focus, and that's why you're pursuing this project. But then they always ask you in the end, what are some of the unexpected outcomes that you found during that time? And pharmacy definitely has that. There's more, I'm sure, than what I'm addressing now.
Yeah, I mean, our program started as a community program, and during COVID, it's been hard to kind of retain some of those elements. You know, we didn't have any in-person things happening for 2020 and 2021, but we've tried our best. But that is what really is, you know, the whole sort of heart of pharmacy is that connection piece. And every year, since we've been working with Tia and Lori at the free clinic too, we've put in flyers for the Rutland free clinic so that the members that haven't heard about the free clinic know that they can access this great organization in our community. Well, I know at the food center, I mean, that's in our, you know, grand 10-year plan is to have, you know, storage, aggregation, more commercial kitchens, so that when we have a surplus of all these vegetables coming in the summertime, that we have programs that are chopping those up, preserving them, canning them, freezing them. And then I do hope that we can extend those pharmacy shares, you know, into the winter. We do have 3 fall shares for pharmacy, 1 in October, November, and December for some of those like root veggies and winter squash. But yeah, it's in our plan to just make local food accessible for the entire year. And that's kind of how our organization started too, because we wanted local food accessible in the wintertime with the Winter Farmers Market. And that's what our facility provided. So that's sort of like at the core of our mission too. So Pharmacy Share is a 15-week curated CSA share. CSA is Community Supported Agriculture. So at the food center, we partner with a certain number of farms who are invested from the beginning, in the beginning of the year, to provide certain vegetables, certain crops that they grow well. And then we aggregate and curate that CSA share for 15 weeks out of the year. So that's why I use share, because it's every week they're getting a bag of fresh vegetables and fruits, if we can get fruit in there.
Alright.
And let's see, I was also going to mention, we do put a lot of other food access information into our pharmacy shares too. I actually just sent an email to our members yesterday reminding them of our pickup today, but then also sharing with them NOFA Vermont has a fall and winter subsidized CSA share that people can sign up for to get about half off of a fall or winter share. So if they really are loving the vegetables and they want even more than just the 3 fall shares that we will provide, we're trying to link them into that program. And there's so many other food access programs in Rutland, and we just try and get people involved in as many as they need.
I think we're the only healthcare, like free clinic, or perhaps I should say we're the only non-food pantry member of the Vermont Food Bank. So, and kudos to them to recognizing that, you know, gosh, we've got interest from a health clinic in accessing some food, shelf items, you know, for their patients. That's awesome. And if, as Emma said, if it wasn't for that Vermonters Feeding Vermonters grant opportunity, when I saw that, the first thing I did was email the contact and say, is there any way we could use this for pharmacy shares? And they said, yeah, I think so. So I applied for the max amount, and it went through. So that has a lot to do with us being able to provide our patients, that number of patients, with this wonderful opportunity. So thinking ahead to next year, if hopefully we'll have that opportunity again, or you know, if there are individuals that believe in the program and are really moved by this, you know, perhaps there's an opportunity to donate in some way to support this work. That's just, I hope we've done a good job at explaining just the ripple effect. It's not just a farm share, you know, it's really a connection, and it's not just something to eat. It's offering better health, overall wellness, right? Relationships, and just
And supporting our local farms.
and supporting our local farms, yeah, which we really love to do in Vermont and need to do.
Yeah, and you know, having just other nonprofits involved, you know, so we have, food bank plus the free clinic. It just builds our capacity every year to have more partners in play, because, you know, having the food bank grant and then being able to purchase the shares from us is just, that just adds to our capacity to maybe include more shares next year, and yeah, there's just a lot of momentum behind all of the partnerships and increasing the numbers every year.
Yeah, great credit to the You First program and the Vermont Department of Health to recognizing, wow, this would be an awesome benefit for our members, right?
Yeah, and you know, we're working with two new growers this year. One like brand new grower to the area, one who has been growing for a few years but is new to the program. So we're always finding new growers to add in, and volunteers. One of the other, Christina Sweet, was working with us this morning, who is also on the Rutland Free Clinic board. So we were chatting as we were packing the shares at the food center today. So it's just great to have all of those connections.
Well, the isolation that some people feel, and then as again, Tony Morgan coined the phrase, I think, you know, being poor is hard work. And it is, you know, it's very hard work, and it's lonely, and it's isolating, and so really this again, it addresses that. It gives that more of a choice to those individuals, you know. So yeah, that ripple effect is just, it's a wonderful thing that we're able to, that the pharmacy program kind of resulted out of the Vermont Farmers Food Center as, you know, some great people around a table putting their thinking cap on and thinking, how can we bring this to the next step? You know, and there is, you know, I work the same way. It's like, there's the next step out there. What is that? What does that next step look like? And then you get there and then you think, okay, now we're ready to take the next step. And that's the wonderful part of this community. I think every step engages more people, whether it's the program participant, whether it's a program partner, whether it's another farmer. You know, we all just creating something wonderful. If I don't have transportation, that doesn't mean I can't benefit from the share, because I may know someone else who's getting a share, or I may simply know someone who maybe works in an area or does have transportation, and they can pick that share up for me. It's not like I need to be present or I won't get my share. And that's just another way this program is very flexible. And I think really, and that promotes the program too, it's that, you know, to have structure in something as significant as this program is, but to make it appear that it's hardly structured at all.
Mm-hmm. Mm-hmm. Yeah, we have a lot of older adults, and definitely during the pandemic we had more homebound people, people who were immunocompromised, didn't want to risk going outside, so we were dropping off for them. And I mentioned Patty LeDuc before, but I think she does like 15 different home drop-offs in the Brandon area.
Surprised me.
You know, she picks those shares up at the community health center and she does her rounds. So it's just been great to have a really strong core of volunteers that help us get all of these shares to everyone in the community. Yeah, I mean, this organization, besides the two here and point two.
Exactly. So we have,
Volunteers.
Lori and I are the only full-time paid staff, and then we have a bookkeeper that comes in about 15 hours a month. And all of our direct patient services, for the most part, 90% of them, are really provided by volunteers.
Mm-hmm.
They're essential to make our work happen. Without them, we wouldn't exist. So get out there and volunteer. There's always a place to volunteer and give some time. And oftentimes Lori and I hear, well, you know, someone has gone without their medication for several months and they just didn't want to come because they want other people that really need this service to be able to get it. And it's like, but you know, you need it. So practice that pay it forward philosophy, right? We have a service available that you could really utilize to keep yourself healthy and well, so you can then be there for someone else. And there's so many volunteer opportunities within any community, I think. You can pick what you're into, you know, what your passion is, and there will be an opportunity there for you. But we are so incredibly grateful for the doctors, nurses, nurse practitioners, I mean, you name it, and our non-clinical volunteers as well. You know, we just can't thank them enough.